All right, good morning. We are live. Today is January 8th. Happy New Year. The time is 10 a.m. and the meeting of the Greater Boroughs Partnership for Health Advisory Board is now called to order. My name is Isabella Crusoe and I am the chair of the Greater Boroughs Partnership for Health Advisory Board. The open meeting of the Greater Boroughs Partnership for Health Advisory Board is being conducted remotely, consistent with Chapter 2 of the Acts of 2025 relative to extending certain COVID-19 measures adopted during the state of emergency. All members of the GBPH Advisory Board are allowed to participate remotely, and this act allows us to meet remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda unless the chair notes otherwise. Members of the public who wish to view the live stream or the recording of this meeting can do so by going to Northborough Media Connection on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. And with that, I will confirm all participants. So Boylston,
Anne Marie here.
Southborough,
Here.
Westborough,
Here.
and Northborough here. And we also have Michaela Petty, our regional epidemiologist and shared service coordinator. And with that, Michaela, all yours. Thank you.
Beautiful. Beautiful. Let me share my screen. Okay. So go ahead and get started. This is the agenda that was sent out previously. We'll just go through our typical kind of updates on what's going on with the shared services, and then talk a little bit more specifically about maternal and child health, some upcoming programming, and kind of thinking about some next steps, and then briefly touch on the local public health internship. The application is live, so we'll talk a little bit more about that timeline, and then approval of minutes and anything else to discuss. So jumping right in with Public Health Excellence Grant updates. This is talking about the strategic plan. So we sent out the RFP after getting final kind of check off from Northborough administration. And we sent that to HRIA, CMRPC, JSI, and BME, a lot of acronyms. But we did receive confirmation that each of those vendors did receive the initial request, and likely intend to submit a proposal. Those proposals are due this coming Monday on the 12th. And then in the contract or in the RFP, it stated that the contract is expected to start no later than the 26th. So by the end of January, we should be up and running and getting ready to go on that process. So this is just kind of where we're at. I'll pause if there are any questions about the process or next steps before moving on.
Have you
Oh,
have you received any proposals yet?
I haven't received any proposals just yet, but I did follow up with all of them to just kind of send a reminder, and they all confirmed that they intend to submit one. So hopefully we'll get those Monday. Okay. Another logistics update. Let me see if I can get this picture to load real quick. 1 second. Mainly just wanting to double check that we're all on the same page for Maven coverage. So let me go back to this slide. So I was kind of going back through, we had the SOP that we created last year, and checking off who's listed for each town. For the most part, Penny or I are the primary and secondary, and we had updated Westboro when Jim kind of transitioned out of the role, but wanted to confirm that this is still the uh, the contacts everybody wants in Maven. So Penny and I will be the primary or in secondary, and then typically the additional contact is the town health director. So want to make sure we're all on the same page. The only thing I also noticed for Westborough's contact when going through was that Cheryl was listed as the primary. And I know that you guys have an additional contact that does mostly TB cases, so just wanted to touch base and
Yeah, so
see.
Cheryl just does TB for us.
Okay, okay. And that's what Penny and I had been doing, is following up on like anything other than TB. So just want to make sure that was still
Yes.
what we wanted. Okay. Awesome. And then while we're pausing here, anything else on Maven coverage?
Just one small thing under the table for Southborough, just flip the phone numbers.
Oh, okay. Yes. I will. That. Okay. Anything
So then,
else?
Michaela, we can maybe do a footnote that Cheryl does TB cases in Westboro, and then add Anne. Anne Labonte is basically like thinking about Sam and VNA. So if there really was no backup, that's we can include her as well. So
Okay.
there will always be coverage.
Beautiful. We like to have. Okay. And then also in the vein of kind of updating contacts, making sure everybody's on the right, in the right place. Um, Wanted to confirm primary and alternate voting members. So I'm pretty sure we have the primary all set, which is for Boylston, Anne Marie, Northborough is Isabella, Southborough is Chelsea, and then for Westborough it's Jen. And then for alternate voting members, wanted to confirm Boylston. I don't currently think I have one. For Northborough, it's Lisa. And for Southborough, it's Taylor West. And then for Westborough, it's Maria. Are there any adjustments? We can start with Boylston just because there's an open position. Anne Marie, do you know who you want the alternate to be?
Yes, Michaela, I just have to confer with one of our newly elected members to the board before I give you her name. So, I mean, Dennis Costello said he would do it, but because of his retirement later on this year, let me just confer with the newly elected before we put anybody down.
Okay, that sounds good. And then any other towns to update primary or alternate? Okay. Perfect. And we can always revisit this if there are changes, but just wanted to make sure I have everybody mainly for the meeting emails. Okay, so then talking about what's been going on, December seemed to fly by with the holidays. So there's been a lot of great things. We've kind of, for the most part, wrapped up vaccine clinics. We were just talking today about potentially advertising kind of a walk-in clinic, given how
Michaela,
intense. Oh, yes.
sorry. Can you go back to the last slide?
Oh, yeah, no problem.
I just talked to Chelsea. She had to go off for another call, but we want to switch so that
Okay.
I'm the primary, but she wants my board to take a vote on it. So we'll switch. I think we need to vote on it, right? And then my board needs to vote on it.
Oh, okay. Sorry, I rushed that.
That's okay. No, you didn't. I was waiting. I had texted her because I knew she was on a call, and I didn't hear from her until after we moved on.
Taylor, do
No
you think it
worries.
makes sense to have your board vote on it and then we come back and vote on it here?
Totally fine.
Okay,
Yeah.
We
'Cause
don't have another Board of Health meeting until February, so
that's
That's
fine.
fine.
okay.
Because our next meeting will be March and we can revisit it. And then Anne Marie, you'll have time to check with your board as well. So we can kind of revisit
Great.
that and take a vote in March.
Great, thanks.
Perfect.
Sorry to interrupt.
Oh, no, no worries. Okay. So vaccine clinics, we were talking about doing a kind of advertising walk-in clinics, kind of to allow people to come in, make a appointment if needed, not necessarily a full standalone clinic, just because we still have 30 doses left. And if there's anybody that wants one, especially with flu being in the news right now, might be a good opportunity to use those up. But for the most part, we've wrapped that up. Penny continues to do blood pressure clinics and office hours at the senior center in Westboro. And she has 2 new home wellness visit clients that she'll be following up with in February. So far since July, we've served 238 residents throughout the course of nursing services. And in progress, we have a breastfeeding workshop planned for February in Westboro with Amy, the lactation consultant from Salmon. And then we're working on maternal and child health partnership building, which we'll talk a little bit more about at the end. This was in our work plan of kind of getting more connected with providers or other organizations. And then I already talked about the workshop, but then we have a pelvic health lecture primarily for pregnant and postpartum women that will be March 5th in Westboro. This was actually a contact that had reached out to Jen and Maria, so thank you guys for looping us in. And we got that set up in Westboro for March, so that'll be an exciting addition. Any questions or comments about nursing services before talking about our health agent?
I just want to confirm that those two workshops are for all 4 towns and they're free.
Yeah.
Perfect.
Yes, and
Is
I have a
sorry.
Oh, sorry. No, I was gonna say, yeah, registration. I have a form, at least for the breastfeeding at this point. We're gonna promote that and then we'll shift to the pelvic health lecture. But there is a flyer which I'll send out with the meeting slides so everybody can post it and circulate it in their own towns.
Perfect. Thank you.
Thank you, Michaela.
No problem. So then we have our new regional health agent, which I believe at this point all of you have met Vinny. He was on our last special meeting. So right now I don't necessarily have an update on inspection data, but just wanted to talk through as he's getting started what we're working on. He's already met with all the towns. He's been doing shadowing and completing his own inspections independently. And he's attended the Northborough and Boylston Board of Health meetings, as far as I'm aware. He will be doing tier 2 housing training upcoming in the spring, and then a hoarding training course that runs from January through April. And his schedule at this point, kind of just while he's getting familiar with all the towns, will be Boylston on Mondays, Southborough on Tuesdays, Westborough on Wednesdays, and then Thursday, you'll be in Northborough. And then Fridays, I don't know, Isabella, is the plan to just ad hoc as needed?
As needed, and this is a very loose schedule, so re-inspections typically Friday, but if anything else comes up. And I also wanted to take this moment to thank Westboro. Maria and Ray have been instrumental in, taking Vinny out and training him, as well as Chris, who's the health agent for Northborough and Southborough. So without those 2 individuals and 3, Maria, Ray, and Chris, the training would be much more difficult. So thank you very much. I appreciate it.
A great hire, by the way. I think he's going to fit in great.
Thank you.
Yeah. That's so good to hear. Yeah, we're excited to have him on board. Anything else about kind of as we're thinking about getting him onboarded or anything on the radar that people want to add while we're here? Okay. So next is the budget, as always. So far, overall, doing pretty well on spending down funds. We did have that gap in the health agent position, as well as the nursing position, still hasn't been filled. So those are kind of some future line items we may have to consider spending down. As of right now, I think the strategic plan really helps us in that goal, spending that 30,000, and then as we move throughout the year can find other ways, either through health communications or additional trainings. But this is just kind of where things stand. Happy to hear any spending ideas anyone has or anything they've been looking at for this group, that we can start to kind of investigate as we move forward. That's okay if not. If you do have ideas, you can always submit the expenditure request report and we can work on it together. But I'm sure in March we'll probably have a better idea of where we're at in terms of final spend down. And in the last meeting, we talked about translating some of the respiratory health documents. So the tips for staying healthy this season has been translated and is ready to go. So I'll also send that out after this meeting. And we adjusted the vaccine kind of information sheets to be more evergreen, or at least we can reuse them year to year. So those have been submitted and should be translated hopefully by the end of January. So we can at least use them for part of this year and probably more so for next year. Okay, before I move on to maternal and child health, any questions or anything about the shared services update? Okay. So one of our objectives is maternal and child health, and this is just kind of an overview slide of what that entails. But really one of the goals is this establishing local partners, which we've done really well with Salmon and working with the community center, but kind of thinking about wanting to expand that into more community partners, like community health centers, and other providers. So oh, I forgot to take this off. We're not doing a mentee. But this is from the FPHS, just kind of where some of this comes from is these are all things that we've talked about in this group and are working on, but still have some room to improve and hopefully partner, considering that in our own group, myself admittedly have limited capacity and expertise in this area. So finding ways to partner with other experts and expand that capacity. So in the FPHS review, these were some of the partners that we had all listed. And first wanting to open up some discussion about, is this a representative list? Is there any other partners we could think of? Specifically thinking about kind of these pediatrician offices or daycares, if we already have existing partnerships with any of these groups, that we could maybe look into expanding or reaching out to.
I have a pretty good rapport with most of the daycares in town.
Okay.
Um, I go to all of them and vaccinate for flu for their staff. So
About how many daycares are there in Southborough?
there's there's um there's two like centers and then one home daycare.
Okay.
And then there's also Southborough Village preschool.
Okay.
So they start, I think, at 4 years old, and it's more aligned with the school schedule, but it's
Okay.
private and the kids are younger. So
I would say one additional resource more at the state level or federal, but the WIC program just for nutrition and they help with formula and other wellness initiatives.
And in terms of kind of programming, like we have the intro to breastfeeding workshop, we're adding the pelvic health, but is there any other either maternal and child or like overall family programming in those areas that you've heard of or thought about that might be something we could look at doing?
I don't know if, oh, go ahead, Taylor.
go ahead, Isabel, it's fine.
I don't know if this answers your question, but I know like rec departments and libraries typically have programming for this kind of younger age range. So I don't know if it's something that we could partner with them on, or if we were to have some sort of program, share our materials through them. But those are the only two I know, at least in town.
And what were you gonna say, Taylor?
Um, I haven't looked in a while, but I know Hoppington has done a lot of like day programs in various excuse me, sorry, day programs like with different types of programming for maternal child health. So we might be able to look and see what they did and maybe not reinvent the wheel so much.
Yeah, absolutely. I think that's where admittedly, this is an area that I don't know a lot about. So even just having other groups that have already done it,
Yeah.
that you all know of, that'd be great. So I can look at what they've done. See, and even thinking like education wise, kind of using that as a point of contact, like we develop a lot of health education materials, but finding the places to circulate them.
And I think one other thing that we had talked about previously was maybe like a community baby shower.
Mhm. Yeah, I know a lot of other groups have done that. And I think it's a great um, program. So I think that could be, would that be something we wanted to try to do, like maybe in the summer?
I think we can look into it. I know
We can
Hudson
look
has
into it.
done.
Yeah, I don't
Yeah.
have like a necessarily a timeline for it, but
Okay. Yeah, I like that idea. Yeah, I know, I think Isabel, you were saying Hudson had done it,
Mhm.
so we could ask them how they did that. Okay, cool. And I know Penny was kind of helping me put together a list of providers too, just so we can have it and kind of start thinking about using them as a point of contact or creating a relationship with different pediatrician offices and daycares in the other towns. So,
so I was just quickly looking. Metro West has done Healthy Parent, Happy Baby. Um, and then community baby showers. They've also done virtual postpartum support groups.
oh,
And then infant massage workshops.
ooh, that's cool.
And then they've Hoppington Health Department's done a Well Mama workshop.
Is this through like health departments?
Some of it is.
Okay,
Yeah, these all have been through health departments.
okay. Because I think that would be with some of the classes, like finding people to lead them is one of the
Yeah, for sure.
challenges. But if we have a good relationship with providers or other clinicians, I think that could be useful. So cool. I'll look into some of these and maybe in March we can kind of revisit and see if there's any that we can start planning towards, if that sounds good.
Like also, I'm just thinking out loud, my pediatrician's office offers like free classes to new parents, like they do it once a month. I actually just got an advertisement for another one and I can send you the information later, but
Yeah.
it was like kind of like a mom's night out.
Oh, I like that.
Yeah.
Especially, I think too, wanting to make sure we aren't, like you said, reinventing the wheel or doing things that are already offered elsewhere. Um, so yeah, I'll look forward to seeing that information. Even like a paint night or something. Okay. So we'll keep kind of working on this and refining the list and thinking about brainstorming what might be kind of next in our programming repertoire. So before I move on, anything else on that one? Okay. So local public health internship. It's crazy that it's already this time of year again because it feels like not that long ago we were having this same conversation. But the local public health internship that's run through DPH, their application just went up this week, and is due February 6th. So we had an intern last summer who worked on kind of a digital wellness project. I know there's been interns in the past with maternal and child health and the food resource guide. So definitely something that's been useful in the past. So the application is pretty straightforward, just about the organization, whether you prefer in-person or hybrid. I think this year they are trying to emphasize that they want at least some component of the internship to be in person. And then the areas of interest and a written proposal kind of with the background of what they'll be working on, what you expect out of the internship, and all that. In total, it's 160 hours and it runs from May 27th to August 12th. There was more information at the LPH monthly webinar, which was on the 6th. So if you want kind of the more detailed rundown, you can look at those slides. But wanted to open it up and see if anybody has ideas for this group to apply to host an intern as a region or even individual towns. If you want help with that application, we can work on that together. But wanted to see if anybody had projects that they would love an intern on or have been sitting on the back burner.
I didn't mean to put my thumb up, but I did want to emphasize that this is open to all towns. So as long as you have a supervisor, your town can definitely apply. Typically, I just write out a pretty broad description for the region just because I know that anything that they do is probably applicable to all 4 towns. So if anyone has any ideas for the group or individually, as Michaela said, that, you guys can fill out this application as well.
And I will send out the link. But any project ideas while we're here?
Michaela, were we thinking of like some like epi topic?
I had just off the top, chronic disease is always one that can be interesting and is not particularly in my wheelhouse and tends to fall off the back burner or fall off the list. So an intern project, that's really great to have somebody go through the data and kind of present to us the top concerns regarding chronic disease and maybe some next steps. So I don't know if that's of interest to anyone.
Potentially, is there something in our work plan?
The other option could be following on the maternal and child health.
That's what I was kind of thinking. If we
Yeah,
had like, I don't know, is there something that we could do to like have have them put together what other community, like something like that, like
yeah.
or like plan, I don't know, 4 programs or something. I know it's
I
different than like a formal project, but it could be fun. I don't know.
Yeah, I think
And take
that
that pressure off of essentially you, Michaela.
I would not mind passing that to someone else who could solely focus on it. I do think I know Rachel had done a little bit of that with the maternal and child health guide, so I think we could maybe shift to kind of that provider partnership, like if they wanted to do like compiling the different programs that their towns do and kind of how we could do that in our area. I think that would be useful.
I think that's a good idea.
Mhm. Okay. So I think if there's any other suggestions, but for now we could kind of go off of that and Isabella and I can write an application that's aligned with that for our group. Um,
And I think
and
also this is like a rough idea.
Yeah.
Once they match you with a student, you kind of talk to them and understand their interests and kind of, shift it based on that. Obviously, we want the internship to be as helpful to the student as possible.
Yeah. I mean, I think either would be fine, but if we could do something that gets us farther in our work plan, I think that makes the most sense.
yeah,
I agree.
I agree. And open invitation if there's anybody else as you think about this for your own town. Happy to work together and do the application if you want to do that for your town as well. So I think we're doing amazing on time. We'll go forward with meeting minutes and future meetings. before we do that, I did have some additional notes about COVID tests. So last time we talked about ordering some for the group, and originally when we looked at it, it was I think like I forget the exact price, but essentially when we emailed the company, we have a discounted rate as a business or as a entity. So they gave us some different options of the types of tests that we can order. We can either order the new versions of the tests that are over the counter. They're a little bit more expensive. I can pull up the exact, let me actually just share this. Can everyone see that?
Mm-hmm.
Okay, so this is the new inventory. So these expire in March of 2027. This is the combined test. So it'd be 384 for 96 tests, which is kind of the packaging that they come in. We had talked about doing roughly 200 kits, and so that would be $2,304. They have existing test kits available, so they're a little bit cheaper, but they do expire this year in May. So that would be 864 for the same number of test kits. These last two are really intended, I think, for providers if you're doing tests on like patients, because it's just one test per kit. So those are a little bit cheaper, but kind of just a different intent behind them. But wanted to briefly discuss what options people prefer in terms of ordering the test before we go ahead and order.
I think it makes sense to do the ones that are expiring in March of 2027 because next year we're just going to be spending the same money to buy new tests and it's going to come out to be the same no matter what.
We
I agree
likely
with
will
Taylor.
just, sorry, Anne Marie, what'd you say?
Okay. No, I agree with Taylor.
Okay, I just wanted to clarify, this is contact tracing money. We won't have these funds for next year. So I think to your points, if we can
Even more
have,
than.
yeah, extend the season.
So are you saying 288 test kits total across all 4 towns or for each of the 4 towns?
288 kits total. So we would distribute that amongst the towns. And each
Okay.
kit comes with 2 tests.
Do you think that's enough? Too little, too much?
Probably want to see more than that
Okay.
if it's going to be for 2 years.
Yeah. I mean, especially with the discounted rate, we've originally been anticipating like double this. So if we want to order more, we definitely can.
So
Is there?
sorry, just to clarify, the 384 for 96, is it test kits or tests individually?
So this is test individually because they break down the price. This is just me kind of showing the math
Okay.
for my own sake because they price it per test, but then there's 2 tests per kit, and then there's 48 kits in each
Okay, so it would be
pack.
48 kits to each community.
It would be whatever 288 divided by
Oh, yeah,
4
sorry. Okay.
is. So 72 kits per town.
72.
Yeah.
So
And
do
I
you
think
want
this, oh, sorry, this was when we originally thought it was just for, like, the expiration date would be this year.
Sure. I mean, I would love to see more. I don't, whatever. I mean, I would say like whatever you think is the reasonable amount to like basically spend down. I don't know.
Yeah.
Do we have any other anticipated use of the contact tracing grant this year? And it's hard, right? Because we have to use it for respiratory.
exactly? So we did put Michaela's the epi salary on
Yeah.
contact tracing, but depending on if we're spending down PHE, we might put it back on PHE. I think it just depends
Right.
on how we spend down.
Right.
But we could probably, I would double check with Hillary if we're going to change the amount, but if we want to double the amount of what you suggested, Michaela, because we can have it for 2 years, I can confirm with Hillary, the grant coordinator for this grant.
I think that sounds reasonable.
And we can always probably do another order like towards the end of the year if we go through these quicker than we expect, while we still have the funds available.
It's until June 30th, right?
Yes, yeah. So we'd
Okay.
have to kind of make that call
It's kind of
probably.
hard in the middle of the summer to decide that, but
Yeah, yeah. Well, and this year with the flu being so
right.
active, it'll probably be faster, but who knows what next flu season holds.
Yeah, I would say if we could double it, that's what I would go for.
Okay, that sounds good. So we will
Do we
do
want to make a
that.
vote on that?
Oh, yeah.
Sure, I vote to purchase 576 kits of the COVID flu 2 test kits for Greater Boroughs.
I second.
Okay, all those in favor, Boylston,
Aye, present.
Southborough,
Yes.
Westborough. What was that? Sorry.
Yes.
Oh, sorry. And Northborough, yes. Okay, so we will work on that. Thank you.
Perfect.
And then, no, we can do this. Actually, Michaela, sorry to put you on the spot. Can you just do like a 2 minute, like what's going on with the flu? We keep seeing it in the news.
Yes,
What's going on?
a lot's going on. Is the short answer. Yeah, flu really took off in the last like week or so. In Massachusetts, the the biggest change kind of from last year and this year is we've seen a lot more pediatric infections that are more severe than what we typically see in trends. We've had 4 pediatric deaths already this year, and 29 adult flu deaths in Massachusetts. Um, so it's a pretty intense year. We're already on track to surpass the peak number of cases that we saw last year, and that was already an intense year. So there's a lot going around. Part of that really two breaks down to 2 reasons. One being the virus just unfortunately shifted after we had developed the vaccine for this year. So the vaccine still offers protection and decreases the risk of severity, but wasn't necessarily exactly the right match that we hoped for. That's just unlucky. The other factor is vaccine rates have been relatively low this year, especially among children. So those two things combined has kind of led to this intense year. So encouraging people while they still can to get vaccinated. It's never too late. Some protection is better than none. And then, staying home when you're sick, trying to practice respiratory precautions as much as possible. And definitely seeking care when the symptoms start to worsen, considering it's an intense year. Um, but happy to answer any other questions about what's going on. The biweekly epi update will be next Tuesday as well, which will probably be a little more in depth. But yeah, thanks for asking.
Perfect. No, thank you.
And
Mm.
anything else for meeting minutes and trainings? Okay. So this is upcoming trainings. January's pretty light. February's pretty light as well. But there's some great Maven webinars coming up. OLRH has a special webinar on HIPAA on the 20th. And then Growing a New Heart, they have kind of topic specific technical assistance trainings. So they have a workforce diversity training coming up. And then NEHA has a body art facility inspector training, which Chris and Vinny are both going to attend in February. So if anybody else is interested, the link will be attached in the slides. Okay. And meeting minutes. We have November 24th and December 12th, which should have gone out with the agenda if I actually sent them out. So any edits or comments about them?
I think it was December 10th.
Oh,
Yeah,
Not
right.
that it matters here, but
I think hopefully as long as it's right on the minutes.
it's right on the minutes.
Okay, good. That was just me on the slides.
I make a motion to approve the November 24th and December 12th meeting minutes as written.
I second.
Okay, all those in favor, we can do a show of hands since we're all on camera. Perfect, unanimous.
Amazing.
I don't know
So
why I don't typically do that.
It's fun to do a roll call.
Yeah.
But I will get those posted to our website this afternoon.
Perfect, thank you.
And then next meeting, so I know Anne Marie, you'd mentioned the May date we may have to change, but our next meeting is March 3rd or March 12th at 10 a.m. and then May 14th. So we'll start with March. Is everyone still okay with the March 12th date?
Yeah.
At 10 a.m. Okay. And then May 15th. So Anne Marie, you said that's MAPHN.
No, May 14th is the MAPHN conference, the 13th and 14th.
Okay. So do we want to shift that to a different day?
A different day that week or a different Thursday?
I'm flexible to whatever works with everyone's schedule. Um, if it's easier to keep it in the same week, we can do that, or we can switch it to the 21st.
Tier 2 housing
flexible.
is that week, and I'm trying to do that.
Okay. So maybe the 21st might be a better time.
No. No,
Oh,
no.
that is tier 2
Tier-
housing. I thought you meant it
Tier
was the
2
same
housing
week.
is the week of, it would be on the 21st.
Okay. Sorry, I misunderstood. So
I could
maybe
do it. It's
earlier.
only until 12:30, so I could do it's until 1. I could do the afternoon. It's virtual.
Okay. Or we could shift it earlier. Or Tuesday the 12th. Does that work for anyone?
I could do that.
I could do
I can
that
do
too.
that.
Maria, tentatively, do you know what that looks like?
One of us should be available.
Okay. And then I
And
think,
then what time
oh,
are we
sorry.
saying?
Same time, 10.
Okay, that works.
Okay.
Thanks.
Okay, I will send out an updated, or Isabella, do you have the meeting invite?
Yes, I can adjust that. Thank you.
Okay.
I will do that.
Perfect. Okay. So we have that. Do you need to approve these? Or vote?
Already
Okay.
did.
Okay, cool. Sorry. Um, Final note before we adjourn, as always, if you have anything you need shared staff for or any projects you're working on that you would like assistance with, feel free to submit the request form. I get an email every time this is submitted, so it should be a pretty quick response to follow up and get started on that. And then request for purchases, if you have anything that you would like to purchase, please fill out the expenditure form and we'll get started on that. And that's all I have. So if there's anything else from anyone in the group, or we can adjourn for the day.
I have a question. So we
Yeah.
have been getting some calls from some nursing homes here in town about COVID-19 clusters. Should
Mhm.
we just send them along to you, Michaela, or are we even tracking that? Are we?
Yeah, that's a great question. You're always welcome to send them along to me and we can be in contact with them. Officially, there's a reporting form online for long-term care facilities to submit if they have a cluster, because DPH kind of is more involved in that. But yeah, you're always welcome if they have questions. You can just forward them to me.
Excellent, thank you.
Yeah. Anything else? Okay.
No, good work, Michaela.
Thank you.
I don't
Thank
know
you
where
all for
we'd be
being here.
without you, so thank you. I move to adjourn the Greater Boroughs Partnership for Health Advisory Board meeting at 10:45 a.m.
Second.
Okay, and all those in favor, you can raise your physical hand. Okay, that is unanimous, so we will mark that in the minutes. All right, have a good January and February. We'll see you in March. Thank
Bye,
you all.
everyone.